Welcome, everyone. We're thrilled you joined us this afternoon for some conversation with Dr. Matt Weiss, one of our medical providers at Campus Health Services, part of an amazing group of medical staff who have been going above and beyond and taking great care of our Lumberjacks here on campus. It's a pleasure to have Dr. Weiss with us today. Thank you, Matt, for being here. And we're also joined by Dr. Steve Burrell this afternoon, our Vice President and CIO, Dr. Matt Weiss. And he's here to talk to us a little bit about our efforts related to keeping our campus healthy and how we've pivoted and used some of our great technology on campus to continue to support our faculty and students during the fall semester. So I think I'm going to start and allow Matt to share a little bit with us about Campus Health Services, what we're doing there in terms of care and testing for students, and also then to talk with us a little bit about two new tools we launched this fall, Health Check and COVID Watch, two of the tools in our tool belt, so to speak.
Thank you, Erin. I'm Dr. Wise, Matt Wise. I've been at Campus Health about 4 years. I was always in private practice. Prior to that, I'm a family practitioner. It has been a challenging and exciting time dealing with COVID and the university and all that comes with that. After the students were sent home in the spring for online classes, we started to gear up right away for the fall semester. We revamped what we do at the clinic, and we have tried our best to separate those with symptoms that might be consistent with COVID from those who don't have those symptoms. They have a separate check-in area, a separate waiting area, and a separate area where they are seen. This took some revamping and remodeling. There was a lot of planning that went into that, and a lot of support. We have some staff that pretty much only work out of that part of the clinic. We went through and did all sorts of things, such as redoing the air vents and filtration systems to try and keep people safe, both the students, the faculty, staff, and the providers and other staff here at Campus Health. We have brought on additional help for care coordination, and we're actually hiring and in the process of training some contact tracers that will work under the authority of Coconino County to help with that, especially as relates to NAU. It has certainly been a challenge from a lot of different aspects. We were able and fortunate enough to get a rapid test. We have the Quidel Sophia test, which theoretically takes about 15 minutes to run if we only have 2 patients to run at a time, because we have 2 of those pieces of equipment. But oftentimes we have 40 or 50 of them to run as we're testing patients with the rapid test who have either had an exposure or who have symptoms. NAU has further developed or has contracted for some mitigation testing. So it's sort of a focused, random testing with a weighted average towards those who live on campus or work on campus more frequently, or individuals such as myself who come into frequent contact with COVID. We were fortunate enough to be able to work with the county on that and the state, and we're currently using Arizona State University Biodesign's saliva testing, which is much more comfortable. I think for most of the patients, I've had both the nasal swab and the saliva testing, and it can take anywhere from 2 to 10, 15 minutes generally for you to produce enough of the saliva for them to do the test. That also has a fairly quick turnaround time. They've been averaging 24 to 48 hours on that turnaround. So that's been very convenient for people. The people in the city of Flagstaff are also, or in the Coconino County, are also able to come and do that testing. There are a couple of other apps that we've been working with to try and limit COVID on campus and protect people. And I think most of the people on this panel, I know Steve and I and Aaron have certainly been involved in this for months. The first one is an app called COVID or Health Check. And with Health Check, each day you log in and you enter your temperature or a temperature range, and it asks you some questions about symptoms. If everything looks good, you get a green card, which means that you are free to come on campus and go about your usual business. If you get a yellow card, you might be at risk. That does not mean you have COVID, but we ask that you don't come right to campus and you see how this plays out, or you contact the care team either here or your own primary care provider. And if you get a red card, we certainly ask that you seek further help and don't come to campus until that has been worked out. We have a care team that reaches out to people, especially at the greater risk category. This is dependent, of course, upon the faculty, staff, and students using this app before they show up on campus. And so we're encouraging all to use that on a daily basis, even over the weekends, if they come to campus on a regular basis. The other app is called COVID Watch. It's an exciting technology. It is completely anonymous, which is hard to wrap your head around, or at least it is for me, or was. This is an app that you can download on your phone. It's completely voluntary, and I have it on my phone. And my phone will send out a random string of numbers by Bluetooth. And if I'm around somebody else who has the app, those Bluetooth numbers will be remembered within the app, but the location and the identification of the people are not recorded. And the phones kind of track each other as to how close they are and for how long. The advantage of this then is that if, for instance, I have a positive COVID test, I can get a verification code and then anonymously share my positive result, and my phone will go back in time and give an alert to anybody that I've been around for a specified amount of time within a certain distance, or at least our phones were together within a certain distance. That app, in order to be called anonymous, had to be approved by both the Apple and Google entities, and that took a lot of work. There's been meetings involving the COVID Watch people and both of those organizations. University of Arizona has been using this app, NAU is using it now. And the app, when it gives you that notification, can also give you some advice as to how to seek care or what your next step should be. And it can also tell you if it was a significant exposure or a milder exposure, or if you've had 5 or 6 significant exposures, which might prompt you to go and seek care. This all takes a lot of work in the background, and our care team has been very valuable, and we're excited to be able to hire some more individuals to help out with that. We started with one of our nurses who we quickly overwhelmed with all of this. But now that there's some additional help, I think we're catching up. It has taken a lot of fine tuning, especially these 2 apps, although everything has taken a lot of fine tuning, to be forthright about that. It's a moving target. Information comes in, we try something, it doesn't work. We have to be willing to adapt and change. And I think we've done a good job of trying to do that. Steve, did you have more to add on those 2 apps that you'd like to bring up?
No, Matt, I think you've covered it really well. It's been exciting, I think, to be engaged in some of these statewide initiatives, but with specific attention and focus on the care of our students here at the university. And I can tell you that we're able to see that 15,000 people a day perform in the health apps that are available to. So, I think the great thing is that all of these apps, not only do they allow us to monitor, kind of what's going on in our community here at NAU, but are also great reminders to people to be vigilant about their personal health care and their responsibilities to not only themselves, but to others here within NAU. And so I'd just like to recognize Matt and his staff at the CHS as being instrumental in helping us roll this technology out to all of our students and in fact, employees and faculty throughout the state. And it's been a wonderful experience, I think, for both our students and the benefactors of that. So thank you, Matt.
These apps are very dependent upon using them. If I'm the only one that's using these apps, neither one of them will be very effective. And I like to point out to the students that really, no matter what university you go to and the steps that have been taken, the precautions that have been taken, in the end, it's going to come down to teamwork among the students, the faculty, the staff, to do the right things and to be extra cautious. There is still a lot that's not known about this virus, and each day more is getting to be known about it, and hopefully we'll get on top of it. I'd like to say soon, but quickly.
Thanks, Dr. Weiss and Dr. Burrell. I do apologize. I forgot to introduce myself at the start of the chat. I'm Erin Grisham. I'm the Vice President for Student Affairs here at Northern Arizona University. And it's been, as you can see from this conversation, it's been a team effort, planning, launching, and getting our resources up and going for the fall semester. We've really worked hard to encourage students to download and use these apps. Health Check is a great resource for us for campus. We've recently opened our campus rec, an outdoor space down on the south fields on campus. And as students check in, we are asking them to show the green passport that you get once you complete your health check. And we will continue to do that when we open our indoor facilities. So it's a great resource and it's a great tool. And as a mom and as a somebody that works in student affairs, it helps students just monitor, Steve, as you said, how they're feeling, what's going on. And so getting in that habit every day of doing the health check, I think is a great self-care for students and for us as staff and faculty. So Steve, did you want to walk us through some of what you had for us this afternoon about the tools and the other resources that we have?
Yeah, sure. Thank you, Erin. Just share my screen here and I'll zip through a few things that we're doing. In addition to the apps that Matt has described and we've been talking about, we're also using technology in a lot of other ways. A few of those is this one being this health check station. We've got several dozen of them spread out around the university in popular buildings and of course in our residence halls, where students can actually just walk up and take their temperature. The interesting thing about these health check stations is they also require you to have a mask on to take your temperature too. So again, not only is it providing feedback to students, but it's reinforcing good behaviors in our community here at NAU. Here's an example of one of the stations they walk up to as they enter the library, and so that's something I think that many of our students are appreciative of, because we're not always carrying around thermometers, or we don't always stop to think about our health. And maybe I've just walked across campus and I'm hot, but do I have a fever? It's just, again, the immediacy of that kind of feedback. Another thing we're doing is
I would just jump in and say those stations are a great resource in all the residence halls. So thank you to you and your team for doing that. And for our really student service areas, they've been a great tool for us there too.
That's fantastic. Thanks, Erin. And another thing that I've thrown up on the screen here for us to look at is kind of these NAU Flex, which is the metaphor for really our service delivery on campus and education delivery. These service kiosks where students and guests can walk up to a particular door and without having to go in, can interact with people, in service roles. We're deploying these in a number of places in admissions, advising centers, so that students can remain outside while the weather's great, and then, maybe come in for their appointment when densities or the people that are ready for them to receive them, can call them in. So anyway, just being thoughtful about, how we're creating touchless engagements. Another thing I think that's been fun and useful is we have occupancy counts in our dining room, and those counts basically count people. They're counting infrared signatures, if you will. And this allows us to essentially manage how many people are in these dining spaces, and also provide feedback to students through NAU Go, which is our community app, which allows them to determine, if now would be a good time for me to go and participate in dining or otherwise manage your time. Again, providing the opportunity for students to make choice relative to how they want to kind of manage their behaviors and activities. And again, I mentioned NAU Go. I want to reemphasize that NAU Go is available to all members of our university community, including parents and friends and colleagues. It's free. You can download it. It's an enhanced personal assistant that is providing a lot of current information about what's going on campus, specifically linking community members and students to recent news and activities and information about how we're managing COVID on campus and testing and all that kind of interesting stuff. One other app that I'll mention that I think has been used pretty extensively is Waitwhile. Waitwhile is an app that allows students to basically get in line virtually and then physically go to their appointment or to the math center or wherever, when the densities of people are conducive to that, or when it's their turn for an appointment or something like that. This again, it just helps us keep people spread out and distanced without having to bunch up in hallways or manage 6 feet apart and all those other wonderful things that we're doing. But you can see there's a good number of different service areas to students that remain open during the COVID pandemic crisis and remain available for personalized services. But we're using tools like Waitwhile and the stations and stuff like that to make sure that students are staying in tune. So that's a number of a few other pieces of technology. I could go on for a long time. You know me, Aaron, about what's going on campus relative to technologies. But let me pause there and see if there's any questions or perhaps any other guided discussion that you'd like to partake in.
Steve, could you share with us again how many buildings or colleges have the temperature stations and kind of share with us where they've been deployed?
Sure. We have 36 units operative right now across campus. Some of those are operative in our testing centers, right? So COVID testing centers, and in our vaccinations for flu shots, right? Because we're monitoring people who go into those spaces to make sure that they're fever free. Then all of our residence halls have a temperature check station. And again, places like our unions, the university library, and other, kind of common areas all have access to those. We don't necessarily place them in the academic buildings. We're kind of evaluating to see if there's a value in that, but we do have them in, most of the public and common areas. And we use them at CHS also to kind of screen well visits versus non-well visits in the lobby of our CHS, for example. So anyway, that's a pretty good summary, I think, of where we've got them spread around.
Great, thank you.
Aaron, I think another important thing to point out, first of all, about campus health is we have switched a lot of our visits to virtual Zoom visits. So patients don't have to come in and sit in a waiting room with other people if they're coming in for non-respiratory type illnesses, whether that's to follow up on diabetes or anxiety, depression, whatever it is. Our counseling staff is, I think, almost exclusively Zoom now. Our psych providers work. They offer Zoom appointments. The medical providers offer Zoom appointments. And then there's the whole realm of what happens when somebody does test positive for COVID and finding their contacts. And I think NAU has done a good job setting up areas for students who live on campus to be in quarantine or to be in isolation.
Mhm.
This isn't easy. It's not easy on the students, and I'll tell you, it's not easy on the staff. There is a tendency, I think, when you're in quarantine or isolation to feel like you got in trouble and that you're in prison, and that's not the case at all. They can still attend their classes virtually. They can still come to campus health if they need to come to campus health. The care teams reach out to make sure they have what they need, food, that kind of stuff. And I'm sure over the course of it, we've found things that we hadn't anticipated, and we try and adapt to that as best as we can. My message to the students is if you need something or you're not doing well, please reach out. There are a lot of resources on campus, from academic help to IT help to medical help to Res Life and Dean of Students Office. You feel like you're alone, but you're not. We try and make that as comfortable as we can. I actually went over, had the opportunity, I guess, to go look at the isolation dorms. I helped a student move in about a month ago, and long story that I won't get into. But I was actually impressed that, at least the dorm that I was at, there was a central courtyard with grass, and you can be outside in that. We do ask people to wear their masks and to spread out. But I think overall it's going to take a team, and I think we're doing, the best we can. And if other people have great ideas, we'd love to hear.
Yeah, agreed. I think, Matt, you mentioned a little bit about the care. There was a question about what mental health support do we have to help students deal with this new environment and the stressors and anxieties around COVID. I feel free to jump in, but I would want to share with everyone that we, as Matt mentioned, we have tele-counseling appointments available. Our counselors are doing a great job with students. We've launched a new mental health support squad, which are peer mental health support staff students. They actually work very closely with the care management folks from Res Life for students that are in isolation and quarantine. We've also launched a new initiative on campus, the NAU Resiliency Project, which is a series of self-guided online tools students can take to learn about anxiety, resiliency, how to take care of themselves, and how to manage the stressors and anxieties right now. So I think as an institution, we've invested quite a bit in our mental health and our counseling services areas, and to make sure that they have the tools to help still connect with students in this virtual environment. I know that post-spring break, our utilization of counseling services, our access to our great staff there went up 7%. And we've continued to provide a high quality level of service to students with our counseling staff. Matt, do you have anything to add to that?
No, I think it's fortunate that before COVID even hit, we were working on, at least internally, what we call path to care to help patients get into counseling and to see the psychiatric team, the nurse practitioners there. And most of that was underway before COVID even kind of took place. Kudos to the NAU students who actually asked for more mental health care, and they were willing to pay for that through their student fees. And that enabled us to hire some additional providers. I've been here 4 years. The last 3 years, it doesn't take very long before counseling has gone to a wait list. And I heard the other day that right now we're not managing a long wait list like we usually do. So certainly reaching out. All of the primary care providers here also address mental health issues. We do a lot of screening, but students certainly come to us as well, and we're willing and able to help out as we can.
Yeah.
I think at this point, there are resources out there. It's not always easy to ask for that help. I understand that, but I encourage people to please do reach out if they need additional support.
I think one of the things that NAU does really well, and I like to brag about it, is our leveraging peer relationships, peer mentoring, peer coaching, and that is also resources that students have available, and our virtual programs and events. And those things are always, as you said, Matt, even while they're in isolation or quarantine, all of those support and opportunities are still available to students. Matt, there was a question in the chat about flu shots. And could you talk to us a little bit about their availability and what the cost is associated with flu shots, if there is a cost?
I will try and address that as best as I can. Certainly, you can schedule a visit to come into Campus Health and get your flu shot if you happen to be in for another reason. Most of the time, we're asking if somebody would like to have a flu shot and encouraging them, especially this year, to get it if they can get it. It's going to get confusing when and if flu and COVID are here at the same time, and there is no guarantee you can't contract both of them at the same time, and nobody really knows what will happen during those times. I can't imagine that it's going to be an improvement. So we are encouraging it. We are also offering flu shot clinics. One of our COVID clinic areas, using that same South Gym space, there are flu shot clinics throughout the week there as well. If you can't find the information online, please just call Campus Health and we can help arrange that. As to the cost, that's always a tricky question because there's so many factors that go into that with people's insurance. Most insurance companies do cover the flu shot, and we're doing our best to make sure that anybody that can get one and wants to get one, that's available to them. And I don't know that I could give you a cost if somebody just came in and paid cash for it, though.
Yeah, understood. I think if you're interested in, there's more information about our flu shot clinics on the Campus Health website. And if you Google search, because I just did NAU flu shot clinic, it's the first link there and you can pull it up. We started our flu shot clinics this week and already have given over 550 flu shots in the week. So that's great work from our campus health services partners. We are looking to have some opportunities for students. We really want to encourage students to get their flu shots this fall. Thanks, Steve, for pulling that website up. And we're going to be hosting a flu shot clinic in partnership with our ASNAU, our student government, outside on the quad, and sometime in October. We're still working those details out. So lots of opportunities for students. Really want to encourage students to get their flu shot. If they do come to the clinic, they're put in to win a $25 gift card to a vendor of their choice, Amazon, bookstore, Jack's Dining Express, JDE. So really want to encourage our students to take advantage of the expanded opportunities around flu shots this year.
Hey, Aaron, I can tell you, I went and got my flu shot at South Gym the other day.
I did too.
And I'm a little sore in my left arm, but you know, it only took less than 10 minutes.
It was,
and so quick. You know, this is something that's really easy peasy. You get in, you get out. The CHS staff make it a lot of fun, and anyway, it was a really great experience.
I got a Bugs Bunny Band-Aid, so I was pretty happy. Robin gave me a Bugs Bunny Band-Aid. I was pretty happy. So
that's awesome.
Could you, Steve, there's a question about the names of those apps again. Would you mind running through, doing a quick review of the two apps, the Health Check app and the COVID Watch app? There were some questions about what each does. And
yeah, sure. Let me just reiterate that again, and let me share my screen so that again people can see. follow that. So there we go. So so the first app I think that Matt talked about, just to keep them in the same order, is called NAU Health Check. And NAU Health Check is available for members of our community. You have to sign in using your credentials, so it's not available broadly. But it's basically available through the web, the NAU Health Check website, which you see here, or through the NAU Go app. And basically, with NAU Health Check, again, participants are going to answer every day several questions about their health. Do they have a temperature? Have they been exposed to COVID, et cetera? And they will get a response of, least risk, maybe at risk, greater risk. And then the requisite advice, links to the advice as to what to do in those particular cases. And as Matt indicated, for those who may have had be at greater risk, right, they may be encouraged to seek medical advice and help from CHS or their medical provider. And in any event, this is a daily thing that creates real clarity around CDC guidelines for students to follow and to understand, should maybe I stay home today, or am I good to come to campus, or should I be seeking more medical advice? So that's NAU Health Check. And again, it's available to faculty, staff, and students through our website or through the NAU Go app. The other one was COVID Watch. And COVID Watch is this community-based app that leverages privacy and the proximity of phones to indicate, maybe that you've been exposed to someone who's had COVID. You never know who. The university doesn't know who. We don't have a lot of details on that. All we know is that this is a community-based app that is really used to help people, again, manage their own health and be aware that maybe they've been exposed to somebody with COVID, then subsequently using NAU Health Check to monitor their symptoms and seek advice from their medical provider. This is a collaboration with the Arizona Department of Health Services and the University of Arizona, who's also participating in this. And as Matt had mentioned, it's based on the Google, Apple identity and confidentiality standards that have been put out there broadly into the public. So Health Check and COVID Watch work in tandem to help people monitor their health, relative to COVID-19.
Great. I would like to say that we're working on an opportunity as a way to encourage students to download and use these two apps, drawings that students can enter once they've downloaded Health Check and COVID Watch to put in a drawing to win a laptop. So,
Aaron, I should throw in while you say that the COVID Watch really is anonymous, and it has been really difficult trying to figure out how many people in Flagstaff have downloaded that app, and they're able to see how many in Arizona because it's mainly the only area it's being downloaded. But I know Steve's team has been trying to figure out how many people involved in NAU are downloading that app.
right.
And then when it comes to that drawing, we don't have access to who has downloaded it, so we'll have to have the students send us a screenshot of it on their phone or some other thing, because it really is anonymous and we don't have their information. It's not stored anywhere.
Yep, we've actually talked about that. And when a student, if they are the selected student to win, they're going to have to come in and show us at their phone that they've downloaded it. We're working on those details with the understanding that we have some of those limitations. Steve, there was a question, and I know you've been engaged with some of the communications around our mitigation testing. There was a question about how many members of the NAU community were testing a week.
Yeah.
And I know you have the numbers. It's between 2,000 and 2,500, correct?
Right. Yeah. So mitigation testing identifies in a shaped sample. It's not completely random, but it's random within the shape. About 2,000 people a week to test. And we've seen very good compliance on that. People are coming in and getting tested. And then, as you pointed out, with the additional testing that's going on, people who just choose to walk in and be tested, or perhaps, through CHS, maybe exhibiting symptoms or something, and Matt's ordering a test or something. So yeah, I mean, we're approaching 2,500 to maybe almost 3,000 people a week with testing, which is a significant portion of our campus population right now.
It is. And
that data is available.
Sorry, Matt, go ahead.
I'm sorry to overtalk you, Aaron. That data is available also on the NAU, the COVID page. You can see some of those numbers anyway. It takes a while to get that updated, and we're not at the point where we can do that daily, but at least the weekly numbers as they come in. The most recent one may be down until that gets updated, but that information is available online.
Yeah, on the Jacks Are Back website, correct? And then you can click on the COVID update website, I believe.
I think you can even just go to the main page and click on for the latest COVID-19 information, and
there it is. Yeah.
First page. I think if you scroll down, information's there.
Great. Excellent.
Let me just share that screen. This is the NAU.edu/coronavirus site. So here's where you'll find a lot of information about the cases that we're managing on campus, information from the county relative to that, and other information concerning testing and COVID at NAU. So again, just to remind our listeners and participants today, NAU.edu/coronavirus.
Thanks, Steve. There's a question about the NAU Resilience Project and where you can find more information about that. There is a website, and I can share my screen and show that with everyone. This is Campus Health Services, our health promotions area. And if you go to that website, there is all information about how to access the toolkit and how students can engage with those resources. Students have been, we are also sharing that via email and some other communications with students. Our residential life staff have been sharing that with students. Lots of our student affairs programs and services have also been sharing that with students. But if students want to just go directly they can just go to that website for lots more information about the Resiliency Project. We are one of just a handful of institutions in the country that have partnered with Florida State University that developed that set of resources for students. And we are quite proud of the work in bringing that to our campus. So they're great sets of tools and resources there for students.
Aaron, there was another question about how do students know that their COVID result was verified, and that pertains to the COVID Watch app.
Okay.
So if somebody tests positive and they choose to share that anonymously, they need to have a verification code, and that keeps people from, for lack of a better word, messing with the app and people around them by putting in falsely positive results. And to get that verification code right now, you just call Campus Health. There are a few of us that are set up here to give those codes. And we're working on other ways to have that happen. Maybe have the code come out directly with the result, where you would receive notice that you have tested positive. If you are using the COVID Watch, here is the code to enter. But as of right now, they can just call Campus Health and get that verification code. If you were tested somewhere else where we don't have the results, then you'll be asked to send a copy to us. You can usually just do that through the instant messaging program. But once we know that it's positive, we can certainly provide those codes. And that also only takes a moment.
Great. Thanks for catching that. I missed that. Go ahead, Steve.
Yeah, thank you. And I just want to make sure to underscore Matt's point there is that even when an individual is provided a verification code to share, it is still their choice whether or not they share that or not. So again, we encourage people in our community to download this app and participate and to share that information as being responsible citizens in our community. But again, not at the expense of privacy or individual choice.
Right.
And Steve, I've had that app on my phone, and I know you have, and Aaron, you've had that app. I haven't noticed it draining my battery or taking up a bunch of space or anything like that. So it looks like you both have had that same experience.
Yeah.
It's very lightweight, and it works both in the equally well in the Android as well as in the iOS Apple environment. And so, you know, it just runs transparently in the background. And, you know, if you're exposed to somebody and they choose to that, then you get a push notification, and it becomes very evident. And again, guidance on maybe next steps that you can choose to take.
Correct.
Thank you.
So I think we're getting close to the end of our time. Dr. Burrell or Dr. Weiss, anything you'd like to share with everyone before we close out our conversation today?
I think I would just like to point out the obvious, that this COVID has been difficult. It's been difficult all around the world. It has led to a lot of controversy, but we're all in it together this time, and we just have to all work together to get on top of this until something else comes along, whether that's an effective vaccination. But even then, I think it's still going to take some time, and it's still going to take some distancing and doing the right things and washing hands and wearing masks and just caring for each other. And that's probably the biggest take-home lesson that I've learned from COVID, is that we have to care for ourselves and we have to care for others. And it's a time to put those differences aside.
Agreed.
Yes, and thank you, Matt. I think my observations have been that, you know, Flagstaff in general and our Flagstaff campus, and even when I'm visiting other campuses around the state, our students, you know, are good citizens. They're wearing masks, they're complying, you know, with good hygiene, and they're considerate of others. And I'm just so proud to be part of a caring community like NAU that has students who really exhibit great care for each other. So it's good advice, Matt. We're in it for the long haul, and Lumberjacks are strong, and we'll lumberjack on.
We are. Thank you, Steve, for students. Saying that about our students and our community, because we really are a community of care. And students have been extraordinary about their wearing their masks and doing the right thing. And it's been a joy to be back on campus. And I'm glad to be back on campus, but it's also been a joy to be back on campus and connecting with our students again. Well, thanks to you both for making time on a Saturday. Thank you to everyone who watched and joined the conversation. Hope you get to continue to engage with some of our family weekend events. Thank you for being with us this afternoon, and enjoy the rest of the weekend.
Thanks, Aaron. Thanks, everybody.
Thank you.